Exciting.
It is.
And I'm
Keeping a low quote.
Wait.
Good, how are you?
Good.
Hi, Ingrid.
Yeah, is he here yet?
He's been in and out.
Okay.
Gary's been in and out. Yep.
So I'm just having trouble with my iPad again, surprise, surprise. And they moved the website too, I found that, hoping that my iPad will update now that I'm here. To do with this thing. Wait for Derek since he's taking minutes.
Yeah.
We have, hi.
Morning.
I'm actually not on a committee. I'm an alternate. They sent me citations.
This is the time to be here because Trisha's gonna talk a little bit about like an overview
Okay.
in human services, so,
Sure. Curious
yeah,
how it all works.
we have 9 members, so I think we definitely have more. But yeah, I don't know, you don't have the same packets that we do.
I mean, I can get to the same.
Ingrid.
Where did you find it in the PDF? Because I think they moved things.
It's not in there anymore. So Sandy was able to
Oh,
help
here.
Francis get it.
I just went to PDF and
Yeah, see, this is what happens.
backed it up.
Thank God they put it on the website or I would never be able to read my packets.
Did you get it?
I did. It's the weirdest thing. I should just take it over to them today. Do you guys have that problem with your iPads? I'm having a problem where like it won't update at home
Right.
on my internet, but as soon as I come here, it will. All of you have that same issue?
No, mine updates.
Sometimes I do,
Is
yeah.
it at home?
Mine updates.
So that's weird.
Have great service.
I never had a problem until I think it was a few months ago it started doing that. I don't know what changed. Well, I think we have quorum, but I'm gonna wait for Derek since he's taking minutes.
Ma'am. I'm.
Oh, you're here. Hey. I'm so sorry, Miranda. So you're gonna be taking,
I will.
okay, perfect. Then we'll call this meeting of the Community and Health Services Standing Committee to order. Looks like it has us starting with a roll call. Miranda, could you do that for us, please?
Yes, ma'am. Miller. Here. Brewer.
Here.
Kramer. Here. Glassbrenner.
Here.
Harwick.
Here.
McGuire. Ferris.
Here.
Brathwaite.
Here.
Checker. 5-7 quorum.
Perfect, okay. And then number 3 is verification of open meetings law compliance. I assume that means whether it's posted or not.
Yes.
Oh, that is good, okay. So then I will need a motion to approve our 14-point agenda.
Make that motion to approve the agenda.
Thank you, Mr. Brewer.
Oh,
Second,
second.
Francis. All those in favor, please say aye. Any opposed? Okay, approval of minutes. Myself and you two would be the only ones that would have been at the last meeting. Did you get a chance to look at those? Any corrections or anything?
I didn't get a chance because I couldn't get it.
Okay. Yes. Well, I saw it on the website and I didn't see anything. All right, we'll just declare those approved and move on to public comment. Is there anyone here from the public or online from the public who wishes to speak? How many do we, it looks like we just have 3 online. Oh, there's a few people waiting in the lobby.
I have never done this before, so.
I'll give you a second, no rush. I don't know. Think if you hit select all, maybe, there we go. Good.
I think that's what works.
Alrighty, welcome to those of you that just joined. We're at the point on our agenda for public comment. So if there's anyone that wishes to speak from the public. All right, if not, we'll move to number 7. So the reason why we have confirmation of Community and Health Services Standing Committee Vice Chair on here is we elected Chair and Vice Chair at our last county board meeting, and on audio, and Miranda can correct me if I'm wrong, it didn't sound like we had a second on the motion to close the nomination and unanimously have Marty as vice chair. So since we didn't have a second, then it's not, I don't know what the right term is. We have to redo it, basically. So I would need a motion and a second to confirm Marty Brewer as our vice chair.
I'll make the motion to.
I'll
nominate
second.
Marty.
Okay, so a motion from Ms. Kramer and a second from Ms. Hardwick to confirm that Marty Brewer is our vice chair, and then we'll just need a vote on that. Do you know, did I need to do like the whole nomination again, or was it literally just that?
You would have,
Oh,
I think it was
okay.
just that. You'd have to, do you have the email that Attorney Wendell sent? I would.
I did, I didn't see that he said we had to. I apologize, everybody, I just want to make sure that we don't run into any more issues with it.
Are you talking
Any
about?
emails, I can't read it now.
While you're looking that up,
Yeah.
Ingrid, may I, mention something to
Yes.
to the committee here? Health and Human Services, Roxanne especially knows that I have many donkeys. And yesterday I called up the various, assisted living and nursing homes. And we have, the dates on when they're going to be out to the nursing homes. May 27th, of course, is Memorial Day Parade. This year, because of the construction up here on 7th, 8th, and 6th Streets, I think, we can't get to the cemetery. So we're gonna do it at Jefferson School for lineup, march north on Jefferson Street. And we're gonna do it out there at the big Veterans Pavilion in the park.
Did you say donkeys?
I have donkeys, mini donkeys. Yep, they're only about. May 30th will be at our house. June 4th will be at Schmidt Woodland Hills. June 12th is Harvest Guest Home. And June 20th will be at Sauk County Health Care Center, right outside of Reedsburg. And Pine Valley, I'm waiting for the, director, not Ann, but, Mallory. She does all the services and stuff to get them out and about. She is on vacation until May 8th, so when she gets back, I'll get a date from her for Pine Valley. But the residents love it. They get a chance to come outside, feed donkeys, pet the donkeys.
Great.
So I just wanted to mention that.
So I found the email, it doesn't make it exactly clear, so on that portion of it. So I think just to be safe, I'm just gonna ask, are there any other nominations for vice chair? And if we would like, we could make a motion to close the nominations and unanimously vote for Marty Brewer.
I'll make a motion to close the nominations and unanimously vote for Marty.
Okay, so a motion by Ms. Kramer and a second by Ms. Miller. All right, so then we need to vote on that motion. So all those in favor, please say aye. Any opposed? Okay, thank you. Got that. Sorry about that, Mr. Brewer. All right, I think before we continue with our agenda, I would like to do introductions. Most of this committee is now new. So I would like to introduce each other and then also the staff members that we have here. For those online, I know it's a little more difficult, so maybe if they need to speak on something, they can just introduce themselves at that time. So I guess we'll start with you and just go around.
So I'm Trish Clements and I'm the director here at Richland County Health and Human Services. In July will be the start of my 3rd year.
She's been doing an excellent job. I'm Ingrid Glassbrenner, of course, the chair of this committee. I have been serving on this committee in some capacity or other before I was even a board member since 2017.
And I'm Marty Brewer, the District 3 Supervisor.
I'm Mark Gill, I'm alternate to this committee, and it was decided mistakenly, but here just.
We're happy to have you.
I'm Sandra Kramer. I am District 4 Supervisor now, but prior to being on the board, I was also a committee member of the Commission on Aging and Disability, and I'm still the chair until we do a vote for the Transportation Committee for the county.
I'm Mary Miller. My background is nursing and I live in Blue City.
Jerry Barris, retired air physician, citizen.
Michelle Harwick, District 3, or District 11. I was looking at Marty. District 11.
I'm Roxanne Kluber-Tansgerber. I'm the manager of RC here in Richland County.
I'm Melanie Walters. I'm a caseworker and financial specialist for the Child Support Agency.
Welcome.
I'm Charlene Layton. I'm also a caseworker and a financial specialist for the Child Support Agency.
Awesome. It's great to see you guys. Welcome. I know this is new for you guys and for us, so I don't want to put you two on the spot. But when we come to your report, would you mind giving us just like a little brief summary of what you guys do? Okay, awesome. That would be great. So that will take us then to our reports. We're going to start with an HHS overview by Director Thomas.
So just want to kind of give you an overview of what our agency is, what we do, kind of what the different units are. So we provide services, resources, and support to the community, and we will serve anyone and everyone in Richland County. And we serve people from birth all the way to the end of life through our different units. We're funded by federal funds, state funds, county levy, and program revenue. Those are different funding sources that we have. I'll now just kind of go over our different units. We have our administrative and financial services unit. They are responsible for supporting the rest of the agency. So they're the first point of contact when you call our office or when you come into our office. They are also responsible for overseeing the budget. So they monitor the budget, make sure that we are getting the revenues that we need, that we are billing individuals in the community, but also submitting our reports and stuff to the state. So it really is to make sure that the funds that we are to receive are received, and then the expenses that we have, that those are all paid. Our next unit is our Child and Youth Services, and they serve children and their families. They are responsible for overseeing child safety in the home. They are responsible for youth justice cases. So when an individual is referred, a child under the age of 17 is referred for a crime. So they committed a delinquency or crime in the community, the referral comes to us and we're that first point of contact. So we do an assessment and then we make recommendations to the district attorney's office on what should happen. When I started in this profession decades ago, it really was a punitive system. It has really shifted and changed to be about supporting and resources. We really look at the child's strengths and their weaknesses and try to build on the weakness or build on the strengths and provide additional supports and services for the children where they have their weaknesses. We also offer services to families. So if there is a family that is struggling to parent their children, handle their special needs, whatever it may be, they can reach out to the family and connect them with services and supports in the community. Our next unit is our economic support, and they really administer government programs. So they assess individuals for eligibility on all their programs. So that's food share, child care, Badger Care, Medicaid, caregiver support program. And they really take a look at, do they qualify? Do they have the supporting documents and verification to ensure that they should be receiving the services that they're receiving. Our next unit is our behavioral health unit. So they provide mental health services to the community. We have a psychiatrist, psychologist, advanced practice nurse practitioner that specializes in mental health, AODA counselor, and a therapist to provide services to the community. We do bill individuals insurance, but if they don't have insurance, we take a look at their ability to pay and make decisions that way on what the cost would be for them to receive services. That unit also provides crisis response. So if somebody is in a crisis in the community and there's a concern that they may be hurting themselves or hurting someone else, that unit can assess that individual and set up a safety plan for them. They provide assessments, treatment, medication management, and our services can be provided both in the office or in the community. We have a program called CCS, and it's our community support program. And they provide more intensive mental health services to individuals more in the community in their home versus office-based. That unit also has a Birth to 3 program, and Birth to 3 is working with families who have a child up to age 3 and providing extra support and resources to the family if that child has some delays. We really want to be proactive and make sure that they don't start from behind. And so that's what the purpose of that program is. We have children's long-term support, and what children's long-term support is works with children with disabilities and their families to give them the extra support and services that they need. Again, trying to keep them from falling behind and really making sure that they can live the best quality of life that they're able to. That unit also has our adult protective services. And so if there's a vulnerable adult in the community, the referral will come to that unit and they will go out and assess the situation and set up safety services if need be. Final program that is in that unit is treatment court. And so treatment court works with the judge's office, the district attorney's office, and it's for individuals who have crimes that are connected to their drug or alcohol use. And so it is an alternative form of punishment. It really is pretty intensive. They have weekly groups. They have real frequent drug and alcohol testing, but they report to the judge every other week and really look at what are they doing, how are they doing, what are their successes, what are their barriers, and providing those supports to them. Our next unit is the ADRC. So our ADRC works with individuals age 18 all the way through end of life. Their focus is working with those individuals who are living with a disability or aging individuals. And then the state considers aging age 60 or over, which seems a little, yes. I don't consider 60 aging, but that's how it is considered at the state. Just to really work with them to provide resources, options, supports, and it's all about helping people maintain their independence in the community for as long as they possibly can. And they're the unit that connects individuals with long-term care programs, again, with that same goal of remaining in the community as long as they can. Our ADRC also has a transportation program. We have volunteer drivers, and mini buses that can get people to doctor appointments, social events, shopping. It really is a great way for allowing people to stay connected to the community when they're unable to drive. Our last unit is our public health unit, and they really focus on environmental health concerns, animal bites, communicable diseases, provide immunizations, and they have a community health improvement plan, and that is created by the community. It's a 5-year plan that really looks at what are our needs for the community and how are we going to help alleviate some of those needs. So our current plan started last year, and we have one focus on alcohol use in the community and binge drinking, and our other one is on mental health concerns. So that is a brief overview of our agency. My goal is, so next month we will be presenting the annual report, and each manager will be here in person and talking about previous year, our successes, our challenges, but we'll also then the month after that have each of the different unit managers come and talk for about 15 minutes to talk more in depth about their programs and give you the opportunity to ask questions.
Thank you so much. That was great. I know it's a lot to take in. I mean, like I said, I've been on the board for a long time and I feel like I'm still always learning something. So it's a lot. And what we've done historically in the past with new board members is we've had like an orientation day. over at HHS, but that's a several hour time period and it's hard to get people to be able to fit that into their schedules. And it's also asking a lot of our staff members there. So Trisha came up with this great idea that since we've been having some shorter meetings, we'll just start featuring a department each meeting and kind of doing an overview at that meeting of that particular department. And that way too, it's a good refresher for us as we go along. And it's not all in one because it gets overwhelming. Even that, I'm sure, was a lot of information for anyone who's new. So if you have questions at any point during the meeting, please ask. If you don't understand, particularly, I remember when I started on this board, the sheer amount of acronyms completely overwhelmed me. I mean, there's so many acronyms that it's really, I still sometimes struggle. So if we say an acronym and you're like, I have no idea what the heck that is, please just ask because there's a lot of them. So any questions right now before we move on? Okay. Do we have anybody online right now or is it not working?
As far as I can see, there's nobody in the waiting room.
So we had lost connection for a bit and
Did you? Okay.
I don't know, I'm asking. 'Cause
That's,
we have people there.
you've been online. Yeah.
Oh, the whole time? Okay,
Yep.
great.
Just hasn't been sharing that screen, basically.
Got it. Thank you. Well, because my question was, we have.
That's me.
Oh, you're speaking.
I'm going to-
Okay.
Yeah, Stephanie's at the financial manager.
Okay.
So that's me, that's.
Well, and so normally with our budget and all of this, it's kind of a consent item. So we have them in the packet. You can look over them. And then if we have questions, we discuss. But since we're all new here, we're going to go over it a little bit more. So we're moving to number 8, item B, HHS expenditures report. So if you're in your packet, it should show up under 8B. Sorry.
So this report is completed and it's probably gonna look different in the next couple of months because we're really trying to figure out what is the best way to do it. But we provide to you a list of the bills that we have paid because some of it we have to prepay. So credit card bills have to be prepaid. Anything with a deadline is always prepaid. But then the other bills that we're asking your permission to pay, and ultimately it's Candace's responsibility to say, yes, you can pay these bills. And Stephanie and Candace, Stephanie is our financial manager, get together prior to this meeting and review all of them. But we put them together so that you guys can see what expenses go out in the month and what are the bills that we pay. Typically, we have all our volunteer driver reimbursement on here, but because of the turnaround, normally our meeting's a week or two later. And so with it being a little bit earlier, we haven't gotten all those processed because they turn them in at the end of the month. And with it only being the second, we don't have that information together. So if you guys have any questions on any of these bills, I should be able to answer them for you. And all bills and expenses, when they come in, are reviewed by the unit manager and also the fiscal manager. And there are certain expenses that if they're over a certain amount, those also have to come to me. So like our regular bills, I'm aware of them, but some of the other ones, like we had a bill on here, and it's with CDW for $1,598. That was 2 scanners. So that information goes to me before they are approved. And then if it's an over $2,000 expense that isn't one of our regular expenses, that has to be approved by Candace.
All right. Any questions on this so far? Yeah. Dr. Barrett.
$520, $29 bill for the highway
Yes.
commission, is that for plowing?
No, so that one was for our vehicle. You guys approved a couple months ago to get the county, to get one of the vehicles from the sheriff's department. And so they, really just did a good look over of it, made sure it was in good running shape, took out all the equipment that the sheriff's department had in there so that it was off and running for us. And we have started using that this week, so that's exciting.
So sold it to us for $500.
Say that again?
They sold it to us for $500, is that what it?
That's probably the best way to put it, yes. Can't complain about that.
Other questions? I know this is a lot, like I said, but these will be on each month. So if you get a chance prior to a meeting to review, and then we can definitely talk about things if there are questions as they come up. So we'll move to 8C, which goes over the budget summary and the Richland County placement report. Wait, I don't see the budget summary on that one. It must be on, oh, there's 2 8Cs. Okay.
So this is what we put together for you every month, and gives you a good overview of where things are at with our budget. Our budget, what we'll be presenting to you is, so in this is the March meeting, we'll be presenting through the end of, I'm sorry, this is the May meeting, so we'll be presenting through the end of March. And how we have it broken down, like if you go on the left-hand side, we have programs, so we have administrative services. So that's our fiscal unit. And then we also, the staff cost, and then we have our building and operations cost. We should be at 25%. We are a little bit higher, but we had to, at the start of the year, pay workman's comp and some of those other once a year payments that are required. So overall though, in that budget, we are under the 20 or close to the 25%, and our budget is doing well. Next, we have our public health. And when we look at what we budgeted and our actual expenses, again, we're doing well. We're at 22% of our budget has been spent. In our ADRC, we have 3 different pockets of money. So our elderly services is our transportation and some of our older adults programs. And then our nutrition program, and then our resource center. And again, all of those, it looks like we're doing very well, and we're under that 25% of where we should be. Our economic support, that one looks good right now. I guess one thing I didn't talk about is, do you want to know how much is like a levy, like if they're levy heavy programs or if they're state federal funds? Is that something that you want me to talk about a little bit more? Does it matter? Do you want the manager to talk about that when we get to that?
I think it's too early.
Okay, I'm good with that.
Probably
I'm good with that. All right.
Certainly head in that direction as we go along. I would
Perfect.
think.
And especially when we look at budget, that'll
Yeah.
maybe make it a little
It's
bit
not
more
gonna be
clear.
much, no.
All right, perfect. So as you kind of look through that, we really have it broken down by program. And so right now our budget is really looking good. When you go to that middle section, you know, we have thus far, you know, what our revenues have been to this point, but we have anticipated revenues. So that is claims that we have submitted to state or federal funds that have not been received yet. And then the other one is our revenues that have been received. When you will go down to the WMH Institute charges through the month, and then the prior to chargeback. So I'll try to explain that as best I could. When individuals go to Winnebago, that would be on like a Chapter 51 hold. So they've been mental health. Thank you. Mental health commitment. And so they have felt that they're unsafe to be in the community and need to be in an environment where they can be monitored, stabilized, and kept safe. When they're there, the county is responsible for those costs. So when the state gives us our payment, they automatically take that money out before they give us our payment. So really it's so that they're not making a payment to us and then we're making a payment back to them. It's streamlining it. But our Winnebago placements are in a placement fund, which is separate from our general fund for health and human services. So when you look at that mental health chargeback, I think that's how it's worded. The chargeback, that is, we just need to take the money from our placement fund and put it into our budget. Does that make sense? That was the hardest one for me. Yeah.
So basically, our budget is covering those costs, but we actually have a separate fund that would cover those costs. So we have to then take money from the separate fund and put it back in our budget. I don't know if that helped at all.
How many, on an average a month? What comes out? I mean, on average over a year.
It really depends. So like January for this year was quite costly for us. We had 3 individuals that were in there for quite a few days. But then when you look at February, we had 1 day and 1 individual. But in January, we had 74 days and 3 different individuals. So it really does vary.
And Trish, what is the average daily, not daily, what is the daily cost?
$1,430, which is the daily cost for Winnebago for 1 day.
So you will see later when we go through the budget process, our budget for placement funds, we have a specific number for that, and it is very large because that is one of our largest costs.
May I speak?
Yeah,
The 2 funds we're talking about, we've traditionally called them institutional funds and for adult and child. And these are the budget busters. About, I don't know, 7, 8 years ago, that's when we realized this was an ongoing issue for us. And so we've tried to corral them and keep them a little bit separate so we can track them easier, but those are the ones.
Well, it's hard to kind of think ahead too, because you just don't know
Right.
how many you're gonna have.
Yeah.
and we can't not have people go, I mean, that's
Right,
a state,
right.
it's a
Well,
requirement.
it's usually court ordered,
Court order.
always court ordered, I think, probably.
But what Marty was trying to say is, as a county, we now have a separate fund specifically for those placements because historically, correct me if I'm wrong, we were covering it out of HHS's core budget. We were always under budget, of course, because you then have these large institutional placements, and then that would come out of the general fund. And so instead of it looking like that, we were like, okay, we know we're gonna have about this much every year. Let's just set aside a fund for that. So I think what was our budget for this year? Is it still 1.4?
Yes.
Does that sound right? 1.4 million replacements. And that includes adult and child. So, any questions on that portion? Well, I guess were you finished? Did you want to talk about the right side?
So the right side is our placements and the cost per the financial system that we have. We really feel the better way to talk about the placements would be going to our other, which is the placement summary report. We can talk about it there. Want to switch to the next one, Miranda?
I think you just scroll down. Yeah, there we go.
Perfect, thank you. So gives you kind of an overview of our placement. So under the adult institutional and inpatient placements, when you look at that institutional, so we have January, February, March on there. We've listed the days of stay and then the number of individuals. So as you can see, our January, we had 74 days of stay for 3 different individuals. And then it puts in there what the cost of stay is, like what that cost us. Now you'll see under there, there's also reimbursements. So there's certain individuals, pending their insurance, that their insurance company will pay for those costs. And so that's where when you look at like January, February and the reimbursements, we did get reimbursements for each of those months because outside entities have covered that. So what happens is we're responsible for paying it, and then the state gives it back to us if they get the money from insurance companies.
So really, we didn't do too bad even with that large amount of stay, because there was quite a bit of reimbursement.
There was, and all 3 of those that we had in January did have another funding source, which was very helpful.
Yeah.
If they didn't, that would have started us off on the wrong foot.
Right, because it looks like we're only 8% utilized, which is not bad.
Correct, yes, yes, yes. I think we're doing really well right now with our adult placement fund. So as you can see, the total fund balance that we had budgeted was 705,000, and our expenses are just under 57,000. And then crisis stabilization, we haven't had anybody thus far this year. And then if you go to adult community residential placements, we do have 6 different individuals who are adults, but they're placed in an adult group home or a community-based residential facility, or an adult family home. And really the primary needs of those are mental health. So the placement is needed to really ensure that they get their medications as they need, that they're getting that intensive support and services so they can remain stable. You know, our goal with having them is so that they don't have to be institutionalized. And again, it goes to the goal of keeping people in the community for as long as we possibly can. Any questions with the adult placement report here?
Trish, could you explain again the difference between the crisis stabilization institution?
So institution would be almost more of a locked facility and a court-ordered placement, where crisis stabilization would be somebody's just in crisis. They're not necessarily at risk to harm themselves or harm somebody else, but they could be down that path if we don't get them a couple days of stabilization. So we have the La Crosse Care Center is typically the place that we utilize for those crisis stabilization.
So they're not emergency detention,
Correct.
So that's not court ordered.
but
It's
they
not-
are in a institution of some type.
Right.
It's not people that are calling up on the service or crisis intervention persons. Yeah, that's not included in this. I take it. There's obviously more than zero.
Correct.
So
Right, so that, you're absolutely right. So we do have lots of individuals that call, that we connect with each month. And there are other ways that we can set up crisis response plans with them that doesn't involve going into a placement. So sometimes it's connecting with them and removing firearms from the home, having them stay with somebody else for a few days, getting them in to see their mental health provider for stabilization, getting them in and getting their medication stabilized. There are other ways that we can also provide that crisis stabilization without being a placement.
What makes the determination that they need to be in a crisis stabilization? Is it just a recommendation from the mental health department or?
Yeah, I would say that that's, through the crisis workers assessment, that he would make that determination. They would make that determination if they need that level of care. And it really is about trying to avoid that institutional placement.
I assume the cost for those stays would be less.
They are a lot less. I don't know right off the top of my head what they are. They are a lot less. And sometimes insurance covers those a little bit more than the Winnebago placements.
So the crisis line, they're going to La Crosse. What is the cost of that a day?
I honestly can't remember, but I can find out and I'll get that to you.
I have a question.
Yeah.
The adult community residential placements, it says community-based residential facilities. What are those?
So I'm gonna let Roxanne answer.
Okay.
So if you look at the hierarchy of facilities, there's nursing homes, which are skilled nursing homes, and then there's community-based residential facilities. So they're kind of like assisted livings, and there's different licensures for each one of those. So individuals that are in those CBRFs or adult family homes as well, they're not skilled nursing, but they get that 24-hour care, they're staffed. So someplace like our house is a community-based residential
Okay.
facility.
Okay. And so then the other ones are, the adult family homes are group homes?
Yep.
And they're not part of the county, correct?
The county can pay for those.
Okay.
And a lot of times what is happening with those placements is they're protectively placed by the courts to those type of facilities.
Okay. Okay.
And some of them,
Thank you.
some of them certified or whatever, would we have more reimbursements?
Yes, so like an adult family home would cost less than a group home, which would cost less, like a group home would cost less than a community-based residential facility. And we're required by the courts, by law, to have them in the least restrictive place possible. So if they are able to be an adult family home, that's where they should be.
Okay.
And haven't you worked with some of the CBRF people to qualify them for state?
Yeah, that's what I was asking.
Yes. So we have through our CCS program, our community support.
Yeah, community, what does he stand for?
Comprehensive Community Services. Thank you. I did make a note to try to get you an acronym list. Through that program, if the CBRF, the group home, the adult family home is certified through CCS, they can bill those services, or we can bill the services that they provide to Medicaid. So when you look down here, the costs, those are room and board costs only for our individuals that are in placement. There are additional costs that we pay the group homes or the community-based residential facilities, but they provide services, we bill Medicaid, and that's how we finish paying them, the remainder. So although it looks like we've only paid the placement facilities, like in the month of March, it looks like we only paid them $7,928. They actually received a lot more, but those aren't county levy dollars that are paying that difference. It's the Medicaid reimbursement through the CCS program. And so the services that they're providing is really helping them to become more independent. So it's teaching them how to take their meds, how to manage their meds, how to learn the side effects of their meds. It's teaching them when they get upset, how to self-regulate, how to calm themselves down, how to reach out and ask for support and services in an appropriate way. So they're learning skills while they're
Anger
in
management.
placement. Anger management, yes, yes. Okay, so we'll go to the backside. Those are our child placements. So right now we have no children in an institutional placement or in detention. And so when we look down to the bottom half, we're really looking at our child foster care and treatment foster care placements. We also have group homes there. So right now we have 11 children total in a paid placement. Through our children's unit, they also do placements through relatives. But if we're not paying them out of county levy, they're not on this report. And that is something we're hoping to work on throughout this year, is to get you a more comprehensive list of all the placement in our children's unit. Ultimately, their goal is to place with families. This just reflects the placements that are paid for out of this budget, out of our placement budget. So the group home and treatment foster homes just provide that additional level of support, kind of like we talked about with the adults in the CCS program. So it's really about teaching skills, self-regulation, anger management. It's for those children who have a higher level of need. For the foster homes, it's more of those children who really just need a safe place to go and they can self-regulate, they can handle their own behaviors. So right now we are a little over on that, or butting up, not over quite yet. 25% is where we should be at, and we're at 23%. But these are ones that we're looking at all the time, and really having discussions about the placements and really looking at what do we need to do to find permanency for these kids, and trying to, and it's not for budgetary purposes, but it really is for best practice on children. Really, I mean, the budget is definitely a piece of it, but first and foremost is about what is the best for the children, and the best thing for the children is really to find permanence, whether it be returning to the home of their families, returning to the home of a relative. It could be guardianship, and it could be where the parental rights are terminated and they're adopted by somebody else.
Questions? Otherwise, we'll move on to our next section, which is 8D, 2024 Contract Monitoring Report.
All right, so that's this report here. We have quite a few different contracts with different entities throughout our different programs. The purpose of these contracts are to provide services to families. So many of our contracts are through our CCS program. So it might look like we're spending a lot of money, but that's not county dollars, those are Medicaid dollars. So they are providing the service, that is a Medicaid billable service. We bill Medicaid, and then we pay the providers out of those funds. Where our report should be right now is at 25% utilization, but you will see that we have quite a few that are over 25, and some of them are significantly over 25. The main reason for those is they are fairly new CCS providers, and we really didn't know how many referrals would be made to them, how much they would be utilized. So we really started out with a guesstimate. So next month, you'll see many of those contracts coming back to you, asking that you increase the amount of the contract that we have with them. Any contract under 50,000 gets approved by you guys. Any contract over 50,000 gets approved by full county board.
Comment?
Yes.
Sorry, I have so many comments.
No, that's okay. The first meeting is always a little bit longer.
This is the potentially the most confusing part of the things that we do here on this committee and then at the board. Because for board members who aren't associated with this committee, you'll see these tremendous, oh my God, that's a lot of money. We're okay in this. And in reality, what we're doing is approving a contract up to that point, not necessarily going to spend it. But we have to have an allowance there for them to do their job. So it can cause some, you know, if we're debating buying a lawnmower for the Parks Department, so, well, why don't we do that and save money here? So it's just a way of doing business. But Trish does a good job explaining that.
I'm sorry, no. And just because we have a contract doesn't mean that we're going to utilize them. So through many of our programs, our children's long-term support and our CCS, or comprehensive community services, individuals can pick who their provider is. So they might come in and many might want to go to one and the other ones aren't being utilized. So that's why we have to have a contract with many, because consumers have the right to choose who they work with.
And as she said, a lot of these are funds that are covered. So even though it looks like a large dollar amount, maybe we have a contract for 180,000, 250,000. A lot of that is going to be covered funds. It's not coming from tax levy.
So if you look at, like, on the budget report, like our CCS total budget is over $2.6 million. And so that really is money in or money out, and then money back in through Medicaid. So we pay our providers and then we get it back through Medicaid billing. One of the main goals of our CCS program is to keep people out of placements. It really is to provide them the supports and services so they can stay in their home and in the community. So it seems like a lot of money, but right now we have 56 individuals in our CCS program and 13 additional people on our to be served list. So there's a lot of people that are being served through that program.
Good. Now, this is a lot of information. Any questions on this so far? Can I, go over these things again at the next meeting, and by then maybe things will start to come together and maybe you'll have a question at that point. Okay.
Can I just make one note?
Yeah.
Sorry. So on page 4, starting on the bottom of page 4, you will see a lot of amount expended are 0. And then on the next page, a lot of those are zeros. We're having some trouble connecting with the state system that monitors those dollars. So those are, those expenses don't really even come to us. We submit the expenses to the state and then they pay them and they keep track of them. So once we get our system back up and working with the state like it's supposed to, those numbers will be a lot more than the zeros that they are right now. So I just wanted to point that out.
So if no questions on that, we'll move to 8E, which is our director's report from HHS.
So in the packet, you will see the May HHS updates. I just kind of want to go through some of the highlights. In our ADRC, one of our ADRC specialists has given her notice, and her last day is on May 3rd. So we will be looking to fill that position. We've already posted it and hoping to do interviews in the next week or two. Under public health, I noted that we're advertising and interviewing for one of our public health specialists. We did offer the position to someone and we're hoping he'll be able to start on May 20th. And under public health also, we are looking to have a kickoff event for our community health improvement plan. So that'll be on May 29th from 10 to 11:30. This is a community plan. This is not just our plan. So anyone from the community is welcome to attend. And if you have any questions in regards to that, I'd strongly encourage you to reach out to Brandy Anderson, our public health officer and public health manager, and she can provide you more information on that. In our child and youth services, we have a new manager. Her name is Kayla Williams, and she started on Monday, April 22nd. So she's been off and running, and so far things have been going well there. In economic support, it is Economic Support Specialist Week, week of May 13th through the 17th. I really want to note for the new board members here, when COVID happened, everybody's Medicaid just froze, and where you were at that point in time, everything remained the same. So this past year, starting in May of 2023 up until the end of June 2024, they have had to review every single Medicaid case to check for eligibility. And so it has been a huge task. They've been putting in extra hours across our consortium and within our office. And so it's been a really busy time. We're almost at the end, so we're looking forward to them being able to just go back to life as normal and not having the year of catch up of all those cases. And so we do really appreciate our economic support specialists. One of the last things that I just wanted to talk with you about, and there should be in there an agenda item cover. If you scroll down just a little bit more on this one, I think it should be on there. Keep scrolling down. Should be one more, right there.
Structure.
Yeah, so
Right in your packet, it's AE, the second AE.
So we're just wanting to let you know, I've talked with Candace about this. She has approved this. So in our behavioral health unit, we currently have 2 mental health therapists. Within the last 2 months, both of them have left. And so we have 2 open positions. With our CCS program really booming right now and having that wait list of 13, we are looking to switch one of our mental health therapist positions to be a mental health case manager. And they can work with the CCS clients and be that service facilitator. So that will eliminate our wait list when we make this move. It's will be absorbed within the budget. So a mental health therapist, an hourly rate for them is $33.10. A mental health case manager, their hourly rate is $24.96. And the mental health case manager, they can bill Medicaid for their service facilitation time. And so really we were wanting to let you know that we're doing this because this is something that will better serve the consumers and really be able to help us eliminate that to be served list. So when a new person starts, they would be able to take all the cases and be off and running. So I just wanted to let you know that is something that we're authorized to do, but I just wanted to make sure that, you know, with Candace's permission, but I really wanted to make sure you guys were aware that that's one of the things we're looking to do.
So that's an additional position, not replacing one of the therapists, correct?
It is replacing one of the therapists.
Oh, it is.
So we'll only fill one therapist position, and with that other therapist position, we'll instead hire the mental health case manager.
Do you think we'll need another therapist?
What we've looked at is, you know, we've had the 2, one had a full caseload and the other one only had a partial caseload. And so we really think this is the better way to be utilizing our budget that we have and the funds that we have.
Okay.
We also are struggling to hire mental health therapist. We've been advertising, I think, for about 2 months. Bless you. We had one individual apply. We have extended an offer to her and we're just waiting to hear back. She was on vacation this week and wanted the week to think about it. So we're hoping to know on Monday if she'll be open to taking that position. And then the last thing is, a couple weeks ago, Evan Ewing, one of the public health specialists, and myself participated in Youth Government Day here. That was the first year that Health and Human Services was a part of it. And it was a great day. It was nice. We had some kids who were very engaged, some not so much, but it was a good experience and hope we can participate in that in the future.
You find that all the time.
Thank you, Tricia. Does anyone have any questions or comments? Yes.
It seems like these jobs are advertised frequently. Why the flow? Is it mental health with the counselors too, that they're overdone, or is it paperwork, or what makes this flow so? It seems like every 6 months somebody's leaving, and is it something we can help with, or is it more on the payment level of state and federal?
I think some of it is on the payment level. You know, we've reached out to some people like with a mental health therapist, they're making $10 to $20 more an hour in the private sector. We're also finding that you can be almost your own contractor through these programs and make a lot more money. And so some people are going that route, especially if they have a spouse that they can get their insurance through. So I think that's what I've seen as the trend for people who have left in those positions is they've gone out and almost become their own private entity, private contractor for these programs. It's hard, you know, it really is. I think right now our behavioral health unit, they're all pretty new. Other than 2 members, I think there's 15 in that unit. Other than 2, they're all new within the like since I've started. So I've hired the majority of them in that unit. And so I think it's just trying to get their feet under them, trying to learn the programs, trying to understand the programs. And I think sometimes they just find that this isn't for them. We're trying to start initiating exit interviews, at least on, you know, providing them the opportunity to give some written feedback. And so I hope that they start utilizing those and to gather the information. I know when our previous county administrator was here, he sent them out and I would periodically get the exit interviews and I found them very helpful. So we're going to try to go back to implementing some of that.
Great, thank you. 8F is our addition of transportation coordinating committee member.
All right, so again, this is another one of those that is just informational to you. Previously, this committee would approve these, but when we look at the rules, it's Candace makes the recommendation to full county board. So I just wanted to let you know that we are making a recommendation to Candace to add Dave Scribbins to the Transportation Coordinating Committee to replace one of the members who are leaving. Candace has approved this and it will be taken to full county board for their approval. So I'm just wanting to let you know that.
And that takes us to G, child support update.
It's up here, so I don't have to.
Yeah, no problem. Would you remind me of your name again? I'm sorry.
Melanie Walters.
Melanie Walters.
Yes.
Thank you. Nice to meet you.
So I'll give you guys kind of an overview of what our agency does. First and foremost, child support's responsibility is to establish paternity. The state of Wisconsin feels that every child deserves to have a father's name on their birth certificate, regardless of whether that father is involved in their life or not. Most of our referrals actually come from economic support, which is at Health and Human Services and through the consortium. If a child is receiving certain type of public assistance benefits, such as Medicaid or foster care, and the parents do not reside together, a case will automatically refer over to us. We look at it to see, number one, if paternity needs to be established. That can be done in various ways. The easiest way is there is a VPA, a voluntary paternity acknowledgement form. Both the parents come in, they fill it out, say, we acknowledge, both of us, that he is the father of the child and we would like to put his name on the birth certificate. If there's ever any doubt, if he is the father, we usually recommend genetic testing. We actually do that in our office. It's mouth swabs. We send it into the lab. About 3 weeks later, we get the results. A few years ago, the state changed it, and now we don't even have to get a court order. We can administratively do genetic testing if both the parents are willing to volunteer to do the genetic test. We still have the option of going to court and getting a court order for genetic testing. And then after that, it all depends on. There's no black or white case. Everything's a shade of gray. What benefits the child are receiving, the situations between the parents is kind of what order we look at. We have a lot of orders that is just a health insurance order. If either the parents have health insurance at a reasonable cost, they have to enroll the child because Badger Care is not considered private health insurance. It is public assistance. So the state has us look at putting orders in place to help ease the burden on the taxpayers. There are situations where we do have to get an actual order for child support. But again, every case is completely different. So we can't say all cases are going to be exactly like this. Once those orders are established, we monitor them. If there is an order for child support, and the paying parent, decides they don't want to pay, after 90 days of no payment, we can file contempt charges on them and take them to court, which can be anything from getting their order changed to up to jail time. It just depends. We work very closely with economic support. We work with the CPS workers because if a child goes into foster care or is placed with a family member, it's known as kinship care. Those cases refer over to us as well. We work with all the departments in the court system. So clerk of court, DA's office, probate, the sheriff's department. And then we monitor, just continue to monitor the cases until the youngest child on the case turns 18 or graduates high school. And then we're done.
Thank you.
Yes.
So I see you've put in a report or agency report. Thank you
Yes.
for that.
Yes, so our agency, the state measures all agencies on these 4 performance measures. These are the performance measures we have received up through March. We have not received April's yet. So paternity established, the benchmark is 90% or greater. We are overachievers. We are at 101.75.
Can you tell me how you can get over 100% on that?
Level 1 right out.
That's great.
And then court order establishments, 80% or greater, we're at 88.73. Again, those are cases that we have established a court order for, regardless whether it has financial obligations or not. And it doesn't always involve a court hearing. A lot of parties, if they are amicable and they've already kind of worked out an agreement of custody and placement for the child, things like that, they can stipulate before the hearing. We provide them the paperwork to do that. And then the legal document is drafted, they sign it, and it goes to Judge McDougall, and she signs it, and they don't have to step into the courtroom. So we try to offer that to parties if they are amicable with each other. Collection on current support, the benchmark is 80%, and we're at 83.11. And then arrears collection is 80%. Arrears is your past due child support. We are currently at 72.12. I did note that our federal fiscal year goes from October 1st to September 30th. Every year on October 1st, the state resets it to 0, and everybody starts with a clean slate. There's currently no counties that have reached that 80% benchmark. As we get farther on in our fiscal year, our numbers should keep increasing. But we are currently 15 out of 72 counties, so I don't think that's too shabby. The second item I want to report on is our agency did receive the Certificate of Excellence Award for the fiscal year of 2023. We have demonstrated excellence in all of our performance measures, and we were only one out of 20 agencies that received the award this year. So to us, that is a pretty high achievement because this last year was kind of a tumultuous year in the agency. So Charlene, the other caseworker, just recently received her notary commission. So now we're both notaries, which is very helpful to our office because we have to notarize a lot of legal documents for court reporting. Both of us have signed up for virtual training. The state of Wisconsin partners with, it's called the Partner Training Team. And since COVID, they offer a lot of their classes online, which is wonderful because we don't have to take time off of work to travel anywhere. So we can take our laptops, sit in the back room, work on our classes. So over the summer, her and I will both be taking some continuing education classes. I did provide the budget sheets for you guys. I'm going to admit neither Charlene or I had anything to do with this budget. That was not our role. I actually just saw this budget for the first time a couple weeks ago, so, it's new to all of us. I will say, for our expenses, the state of Wisconsin reimburses the county 66% of our agency's expenses. So only 33% at the end of the year ends up being on the county dime. As of this report, we had not received any payments from the state of Wisconsin, but Mr. Evans just reported to me that we did just receive a payment of almost $32,000 from the state after I had submitted the stuff for the packet. Some of our expenses that we have, such as like sheriff's fees for serving individuals, the cost for genetic testing, vital record processing fees, different court costs. We actually can put those in our court order to have case participants pay that back to the state or the county. So you will see that's why it's listed as an expense and also as a revenue, because that is something that we can get a court order for to be repaid back. Did you guys have any questions on our budget? Like I said, it's kind of new to everybody. If you do, I would try to answer.
I don't think I have any questions.
Melanie was in the department and
Yep.
she left and now she's back. I'm glad she's back.
Thank you. Charlene was also the same, had left a few years ago, right? 8 years ago? 8 years ago, and came back this last fall, so
All right.
we'll revisitors.
I see you say on number 6, what you would like us, or what do we want you to report? This is new to us, so I don't know what typically or how often you guys have reported, because you were previously reporting to finance?
Pine
No.
Valley.
Pine Valley.
Pine Valley and child support was together.
Okay.
And that's changed too, because I know when I was here the first time, we were like once every couple months. And so then we kind of got put every month as well, so.
So up until now, it was every month? I don't know that that's
It got,
necessary.
right, it got
Would
I mean-
quarterly sound?
onerous.
Or even
What it was before.
Right, I mean, I know we get like our performance measures are sent to us each month by the state. You know, if you want us to, we can include them in the packet for your review. We don't have to come and report on them if you'd like them more just for information. Or we can just kind of keep track of them and again, report quarterly.
For review, what do you think as far as? I mean,
Yeah,
I personally think probably quarterly would be enough.
I agree.
That sounds.
Does that sound reasonable to everyone else? Okay.
okay. And then I guess if there's anything kind of out of the ordinary,
Yeah. You
then
could always add it to an
add it
agenda.
to the agenda, okay. And then
Do you guys ever have expenses that you have to come through our board, like that go to county board?
I think very, very rarely, because
Okay.
most of our expenses are pretty minimal. I think the last thing that had to go through county board was, we had it, when I was here previously, I believe it was approved for our office to hire a part-time position.
Okay.
But as far as our actual expenses, I can't think of anything that would be over the threshold that would need committee approval.
Okay.
And that was going to be kind of one of my other questions too, but if we're going quarterly, it's probably a moot point, is previously at the committees, we had to turn in a list of all the bills that we paid. But when Candace and I talked about it, she said, your bills are very minimal. And she said, Amy Forehand's currently our interim director. And so she looks over all the bills, and if she sees anything out of the ordinary, she pulls it off to the side. But Candace is like, I think if your director's looking them over and they're minimal and she's approving them, and then they have to go to the audit committee to approve to pay anyway, it seems like a lot of just rehashing it through a lot of
Right,
committees.
I don't see the
So,
point of that,
okay,
unless there was something that the county board was going to need to approve. I don't think that
Okay.
we would need to,
okay.
that sounds fine to me, unless
okay.
anyone objects.
Yeah, and the only thing I could think of that might be out of the ordinary is I do know it was approved for a part-time position. We are currently in office of 2 people, and then Amy Morehand is our child support attorney and our interim director right now. And then Candace said she just kind of wants to see how things settle, you know, because again, Charlene just came back in the fall. I just came back at the end of March, and then we'll kind of make the determination for staffing. And then the decision will be made if we want to actually hire another full-time director or just have Amy continue to be the director. So we haven't landed on a lot of stuff yet. It's just getting back into the flow of things. So.
Well, maybe once you have some updates on those things, even if it's not quite to the quarterly, maybe you could come back with that information.
Okay.
Otherwise, still at, I don't know, quarterly, where would that put you then? I don't know if you just want to figure out a schedule, that would be.
I was gonna say technically June would be the end of the quarter, but we wouldn't get our June reports until July, so.
Maybe a month after
Okay.
end of the quarter. Okay, that sounds good.
So I will plan on, right now, the July meeting unless something changes, and then we'll report on June numbers.
All right, thank you. Does anyone have any questions for her before we move on? No? Everyone's probably feeling overwhelmed. I sympathize. Thank you so much. This was very informative. Okay, so number 9, contract approvals. I don't think we have anything, correct? Okay, so that takes us to 10 resolutions. 10A, purchase of new phones for community services building. And thank you, ladies.
Okay, so through our public health unit, we have $353,000 of ARPA funds to use by the end of the year. So with having those funds, we really took a look at what are the things that we need that we could potentially use ARPA funds and not have to use county levy for. One of the things that we found is our phone systems, like our actual phones, are reaching end of life. And so their end of life for the phones is the end of this year, or excuse me, is in November. And then any support that we will get for those phones is July 31st, 2025. So this has been something that we've been thinking about that we need. And so we're looking to bring it to you and then to the full county board to use the ARPA funds to purchase new phones for the community services building. So this will also cover other entities that happen to be in the building or that would be in the building if it were ever deemed appropriate in the future, but we're asking that you will approve $24,765 to purchase new phones for the community services building. And then we would take that to full county board for their approval, their final approval.
I have a question for
Yes.
you. So actually with both of these resolutions, I know at one point we had discussed, like, I don't remember wherever it landed, if it was gonna be a certain amount, the number of bids. Do you know if they got more than one bid, or is this somebody that they?
So Barb is on, and she can correct me if I'm wrong in regards to this. So this is one that we would not need bids for because it connects with our whole system. And so if we went and got bids from somebody else, it wouldn't connect with our system and we wouldn't be able to utilize them as efficiently.
Okay. So Barb, feel free to speak up if you need to correct us, but that sounds good to me. Okay, any questions? Ready to?
You said there's technical support with this too, or is that?
So the technical
part of
support
the
will,
purchase price?
that's my understanding, yes, that we're able to reach out to them when the new phones come and they'll be able to give us support on the new phones.
And for how long is that? Do you have that contract?
Current phones we've had is a really long time, so we wouldn't be entering into a contract. It's just kind of one of the services that they'll provide for that is that extra support on the phones.
Now, what's the difference between a 706930 phone and a 306915 phone?
So we're looking to purchase 70 of the 6930 phones. So it sounds like that has more of those bells and whistles. So like the phones almost be similar to the phones that I have right now. So I'd be able to see, it has, I think, 3 different screens with numbers to be pre-programmed in. I can see if different individuals are on the phone. I can see my missed calls. I can see my call history. So a lot of that will be on the more expensive phones. And so we're looking to those for the offices and for the workers so that they have those at their disposal. The other phones is really just a plain Jane phone. I'm gonna pick up and I'm gonna call and it can call in, but it doesn't have any of the bells and whistles.
Something that you put probably in one of your conference rooms or
Yes,
something.
exactly.
Okay.
Yep.
Madam Chair,
Yes.
will we be able to talk to this building with those phones?
Yes, so we can, yes, yep, they're all on the system, so we'll be able to call over to here.
That's the one thing we needed
Yes.
to accomplish
Yep.
over the years.
Yes, yes.
And with Pine Vale, actually, so.
Yeah.
Don't know if that's, you don't know.
Have you not used any of this money yet, the $350,000?
So we've not used much. We have purchased our leadership training. So right now, the leadership staff at Health and Human Services is working with Southwest Tech to do their leadership academy, and we've used those funds to purchase that program. When we had the money, it was really limited. So last September, they expanded the ability to use these funds. Prior to September, you could use it for COVID-related expenses only. So if we were going to do contact tracing, vaccination clinics, you know, some of those things. I think when COVID started, a lot of money came into our department. And this was one that we just kind of kept at the back burner. And really, as of last summer, had no intentions of using it because we didn't have a use for it. The state came back and said, we're now expanding the use of these funds. And so we're looking to utilize it more. So the other thing that we have spent it on, I'm going to backtrack a little bit, was the county website. The county's looking to get a new website. So we have used these funds to pay for that. I know. Waiting. And infrastructure is one of the big things that they expanded it to, so that's some of the stuff that we're looking at. So the new phones, the website. We did look to get a quote for a digital sign at our building. It's a little bit more than what I'm comfortable spending the money on. I'd rather use it for something else. So last month, you guys approved getting a vaccine refrigerator with these funds. So all three of these, because the next item is also with those ARPA funds, all three of these will go to the full county board next month.
So how much will you have left after you pay this?
You're gonna make me do math in my head. I think probably still around 250,000. So we do have a plan, some of
Used
the,
by December.
yes. So some of the things that we're looking at is, I know Candace is looking into some leadership training for the county board and for department heads, so we can use those funds for that. We are putting additional cabinets and stuff up in our public health department right now, or the public health unit right now, storage cabinets, just things that we need there, so that Randy with our maintenance department is working on that. It can be used for the Microsoft 365 upgrade that's happening at the county level. It could potentially be used for the finance software. So we're really just trying to go through and look at what are the things. We do have it spent in the respective, we've got an outline put together of what we're wanting to use it for. And if that's something you want me to present next month at the meeting, I certainly could do that so that you can see where we're at. And then that's something we can have as an agenda item every other month or something to keep you in the loop of where we're at with those dollars.
The reason I asked is we're only halfway into the year. What does the rest of the other half of the year look like for this? So,
Yeah. So I can bring that next month. I can have that in our report.
Okay, any other questions pertaining to this particular resolution?
No.
If not, I'll take a motion to approve the purchase of new phones for the service. Thank you, Michelle. Do I have a second? Sandy, any other discussion? Okay, all those in favor, please say aye.
Aye.
Any opposed? Say no. Okay, that takes us to 10B, and the other items on 10A show the bid that we got and then the resolution that will be sent to, with the official wording to county board. So then if you move to the first one on 10B, that will be our agenda item for the network switches.
All right, so, and I do have Barb on in case if you guys have more questions, because I am not a technology person, but we're looking to purchase new switches for the community services building. Their end of life is next year. The total cost for the switches is just over 48,000, so it's $48,471.28. And what the network switches do, it's a piece of equipment that allows devices to communicate with each other by forwarding data packets between them. So that is something that we would need just to be able to function and use our computers in the building. If we don't utilize these funds, we would have to look to purchase them next year with county levy dollars.
And I know we use JComp for a lot of things. Is this similar to the other one where we
It
need
is.
this? Okay.
Yes,
Makes
yes.
sense.
I think we just did this for the board.
Any questions? Do I have a motion to approve this agenda item or resolution, I mean? Thank you, Michelle. Second by Ms. Miller. Any other discussion? Okay, all those in favor, please say aye.
I,
Any opposed, say no. Okay, that takes us to number 11, discussion and possible action set for future meeting dates and times. So historically, for the last, I don't know how long, we've been meeting on the second Thursday of the month. The time has differed a little. We're back at 9:30, which was what it had been for a long time. For a while, we had pushed it a little later, particularly during the COVID era when there was a lot of other meetings happening. So the recommendation for this committee is to have it within that first week, because then the second week, the executive committee meets, and then the third week, the county board meets. So I guess my question is, do you guys have any difficulty with this date and time, the first Thursday of the month at 9:30? I certainly want to hear if it's going to create issues.
I don't with the date. I
With
have
the
difficulty
times.
with the time. And, I mean, I work full time, so I'm using vacation time to actually come to these meetings. That's gonna prove to be an issue, especially with my husband. He's not gonna like me wasting, I should say waste, but, giving up my vacation time to come here. I know I do have the option of joining
Virtual.
on,
Yeah.
virtual.
Would that be feasible for you?
It's still taking away from my work time. So it really doesn't matter if I'm physically in the building. I mean, if I'm at work and doing the virtual meeting, I'm not doing my job.
Yeah.
Mhm.
Um,
Well, so the issue that we run into though is if we do it in the afternoon or in the evening,
mhm.
then we're running into all of the staff members that are presenting at these meetings, also having an issue with the overtime or,
Got it.
being over their hours. So that's one of the
And I'm
struggles.
done at 2:30 or 3:30 every day.
Okay.
I don't know how late all the departments work till, if it's, 9 to 5, 8 to 4.
Like at 3:30. How about the rest of the board members? Would an afternoon work for the rest of you?
Not on the first Thursday for me.
Okay.
Not on the first Thursday. What were you gonna say?
school bus driving.
Oh, that's
yeah.
right.
Yeah.
Many
So I mean, I think all of us are gonna have,
many employers let you do it. It's part of their civic responsibility.
Have you, yeah, I don't know.
I have not approached the conversation yet.
Well, and I will say this is a little bit longer than what our meetings have been.
Mhm.
Typically, once we're kind of in the swing of things, it's been an hour less sometimes than an hour or less.
Okay,
Usually.
okay.
Once in a while, if there's something big on the agenda or a budget issue or whatever, it might be over an hour, but typically less than an hour.
Okay, I will figure it out.
We always have that argument, let's have them the day, then people can,
Right.
staff can be there. No, let's move it tonight, then general public can be there, so.
So we do one meeting every year where we offer it in the evening to make it more available for public. And I will say in all the years I've served, I don't know if we've ever had any public show up at our evening meeting. So that has not seemed to be effective. But how about we try it for a month or two? And I don't know if it becomes not feasible for you, maybe we revisit. I don't know.
I can be seen and heard when I join.
You can.
Okay.
You don't have to be on video. I mean, if you can, that's great. But and even if you call in with a phone, I believe that works as well.
Okay.
Well, Michelle here.
I know. This is always the problem.
Yeah.
With serving on the county board in
And
general.
I knew that, that was gonna be a strong possibility, so. Okay.
What other boards are you on? Just out of curiosity.
Southwest Wisconsin.
Are you on any of the other standing committees?
No.
Okay, because I know like the executive meets in the evening. I don't know about the others. Any of them do, but. All right, well, I'm sorry. Let us know.
I'll figure it out.
Okay.
It's good to get a mix of retired people and people who are working, so that's the goal.
And this has been our issue for those that are working,
Mhm.
it's just difficult. All right, well then I guess we'll leave it as is for now. Do let me know though if this turns into an issue for anyone, and if Michelle, like I said, if it becomes not able to work for you, let me know. Correspondence, I don't think we've got any correspondence. So future agenda items, we mentioned monitoring those funds, and then you had some other things.
Yep, so if we could add the HHS annual report, we'll provide a report to you on that.
Okay.
And then our 140 review for public health will be back by then, so I can, we'll give a presentation to you also on our 140 review that was done by the state.
So annual report, the 140 review, that was for the Department of Health, or the Public Health.
Public
right?
health, yes.
So you review, okay. And then, I don't know if we're going, when is that chip kickoff? Do we want at some point an update on that? It doesn't have to be next month maybe, because we've got these extra items, but maybe in July. Anyone else have anything they would like to see covered? Okay, all right, that takes us to adjournment, so that'll be then, we're gonna adjourn to, it would be June 6th at 9:30. So I have a motion for adjournment.
I'll make that motion.
Thank you, Ms. Kramer. A second? Dr. Barris? Hey, all those in favor, please say aye.
Aye.
Any opposed? Great, thank you all for coming, taking the time. I know it's a lot. Appreciate you serving here, and thank you guys for all your preparations.
Yeah.
Okay, that's what I was wondering. So that's why I was like putting down notes, so.
I think I'll just send you and say, this is all the stuff that I want.
Oh, perfect. That would help me because I'm
Okay.
not going to remember it all.
Okay, and then I'll
I'll
just
try to
turn
write
to
things
him
down.
and you would email it for that, saying as
And
we
then you wanna
discussed,
join
Ingrid,
the-
here's what we'd like to see.
Yeah, I mean, it, you don't have to send me the first one if it makes
Here's
it
the
work.
date.
Okay, wrap it all up in one, and I can be like, wait a second, if I have a problem.
Okay.
That sounds good. Whole issues with that.
Okay, all right.
Okay. Yeah, you just chat in there. And you'll credit.
Okay.
Yeah.
Wonderful.
No,
Thank you.
WhatsApp and regular computer,
This will be our season, so, you know.
to the county website on your regular.
Organic?
Well, we're not certified, but we do.